continue our ongoing series of interviews with our researchers through the Vasculitis Foundation today. Dr. Robert Micheletti is my guest. He's based out of the University of Pennsylvania Perelman School of Medicine and is right in the middle of a current study being funded through the VF, one of our many researchers doing work with those funded studies. So first off, Dr. Micheletti, thank you so much for joining us today, and let's go through your study a little bit and just take us through some of the specifics of what you're currently working on.
Yeah, thanks very much. So our study is called ARAMIS, which stands for a randomized multi-center study for isolated skin vasculitis. And basically, this study is aimed at patients who have vasculitis that affects the skin and not really other organs. So these patients, traditionally, we don't have good information for any of the drugs that we use. And so what we do for folks really is based just on expert opinion and really case reports and case series. So the aim of this study is to take patients with skin limited vasculitis, whether it be leukocytic classic vasculitis or Henoch-Schönlein purpura, otherwise known as IgA vasculitis, or polyarteritis nodosa, if it's skin limited, and then basically randomizing them to one of 3 different drugs that we think are effective, and then collecting data to determine which of those actually is effective or most effective. And if a patient isn't doing well on one of those drugs, then we actually re-randomize them to one of the other 2. So we're hoping that for an area of vasculitis that's really understudied, the skin, that we'll be able to come up with information that's really helpful to patients. And I think one thing that we know in treating our patients is that even though it may be, quote, just the skin, it's not the kidneys or something like that, it is something that really means a lot to patients because it's visible, it's painful, it's itchy. All of those things are really impactful for quality of life. So that's something that we're trying to address with this study through the Vasculitis Clinical Research Consortium. And we have about 30 sites in total in Canada and the U.S., and probably this will be going on for the next 2 years or so. For us to get enough patients, for the study to be complete, and then hopefully at that time we'll be able to share results, possibly along the way, depending on what we see.
With the overall results, once they come in, what sort of impact do you hope this could bring with these particular patients who are dealing with the more skin-related types of vasculitis?
Right. So I think it will be helpful because, quite honestly, the way we treat patients with skin-limited vasculitis right now is sort of the treatment du jour. If you happen to see a certain provider who happens to like a certain medicine, that's what you'll get. And, maybe not the right dose, maybe not the right duration of therapy to really know if it's effective. And so there's a lot of trial and error. And we hope with this that we'll be able to say more accurately that, drug X has the best chance of being effective, so people don't waste a lot of time hopping from one medicine to another and really not getting where they want to be with their skin vasculitis. So hopefully this will lead to some important improvements in what we do.